Good day, grade 10 health warriors. I am happy to be with you again in another session full of fun and learning. Welcome again to Valenzuela live streaming. Be with me as we explore health education. I am Sir Alfred Santos, your Mapeh teacher for today. We formally start, let me give you some reminders to our social media netiquettes. Students, here are some reminders during our online discussions. 1. Be on time. Make sure that you log in on your account and follow the given schedule. 2. Find a quiet place where you can concentrate from your online class. 3. Listen attentively. Stay focused and avoid interruption. You may take notes while listening or watching. 4. Think before you click. Avoid unnecessary comments on the chat box. Refrain from sending unrelated sticker comments in our comment section. 5. Do not multitask. Turn off distractions. Focus on one thing at a time. 6. As much as possible, do not use all caps when writing in the comment box. And lastly, always share useful and relevant information. Let us all learn together and enjoy the rest of our discussion. I hope everyone will be guided by the rules for us to maintain order during our session. Allow me to give you the competencies that you will develop throughout our discussion. At the end of the lesson, you will be able to select health professionals, specialists, and healthcare services wisely. B. Report fraudulent health services. Now, let us have a short review. Grab your pen and paper and write your answer in your notebook, or you may directly type it in our comment box. You have 10 seconds to key in your answer in our comment box after the word go. Identify the correct answer based on the information given. Select the best answer from the following choices: health services, health professional, health insurance, health products, and health information. Are you ready? Number 1. It is any concept, step, or advice that various sources give to aid the health status of an individual. Go. The answer is health information. Number 2. These are products that we consume to improve our well-being, such as medicine, vitamins, food, medical devices, disinfectants, beauty products, and many more. Go! The correct answer is health products. Number 3. These are programs we avail from various providers such as physicians, nurses, therapists, health workers, hospital clinics, and insurance companies. Go! The answer is health services. Number 4. These are individuals who are licensed to practice medicine and other allied health programs. Go! The answer is health professionals. Did you get it? Impressive! For the last question, number 5. It is a financial agreement between an insurance company and an individual or group for the payment of healthcare costs. Go! The answer is health insurance. How many correct answers did you get? Can you give me a heart or a wow emoji if you were able to get the perfect score? Great! In case you weren't able to get all the items perfectly, don't worry. What you did today is a good start towards improvement. All learnings about consumer health will be very beneficial. These serve as bridges to fill the gap between the patients and health sources. With that, always remember, health is wealth. Allow me to share with you a short story. Listen attentively and prepare to answer my questions later. You may also take down important details. Slim tea. Anna, a 17-year-old student, heard about a trending online product advertising a quick solution for weight loss and skin whitening. With the alluring effect of the tea product, she spent 1,000 pesos for the item. However, after a week drinking the product, she experienced allergic reactions that caused her to severely vomit. Upon checking the contents of the product, she found out that it has substance which is not good for the body. She even read reviews about the product on its Facebook page, and it seems like she is not alone in experiencing its side effects. Anna was a victim of quackery. What is quackery? Quackery is a form of a health fraud, an advertisement, promotion, or sale of products and services that have not been scientifically proven safe and effective. It is being operated by a quack. A quack is an individual that has a little or no professional qualifications to practice medicine. He may endorse products or services with a promise of quick cures, miracles, or unbelievable formulas. There are a lot of frauds not just in health products and services, but in almost all kinds of trading, and consumers are the usual victims of these unfair acts. Have you experienced this kind of quackery? What are the things to consider for us to avoid circumstances like this? In this time of pandemic, it is very important for us to be vigilant in availing products that we use or consume. Crises often provide new opportunities to people to reproduce these fake products that may threaten the consumer's life. Now, the question is, why do people easily fall for quackery? You may write your answer in a clean sheet of paper and submit this to your Mapeh teacher. In our previous lesson, we discussed reliable and unreliable sources of information, products, and services. Before we go further, let us define health professionals and health services. Health professionals, these are individuals who are trained and licensed to practice medicine along with allied health programs and work in the medical profession. Health services are usually offered by healthcare providers. A healthcare provider is a trained professional who provides people with healthcare. Medical professions are the most reliable source of information when it comes to health. Knowing each of these professionals and their functions can give benefits such as the application of immediate and appropriate treatment, avoidance of time and resources wastage, and the like. Knowing them will not also lead someone to avail of fraudulent health services. Now, let us identify some physicians and areas of their specialization. Cardiologist, a doctor who specializes in the study or treatment of heart diseases and heart abnormalities. Dermatologist, a medical practitioner qualified to diagnose and treat skin disorders. Orthopedist, a physician who corrects congenital or functional abnormalities of the bones with surgery, casting, and bracing. They also treat injuries to the bones. Ophthalmologist, a specialist in the branch of medicine concerned with the study and treatment of disorders and diseases of the eye. Gastroenterologist, a medical practitioner qualified to diagnose and treat disorders of the stomach and intestines. Geriatrician, an expert in the branch of medicine or social science dealing with the health and care of old people. Gynecologist, a doctor who specializes in female reproductive health. They diagnose and treat issues related to the female reproductive tract. Neurologist, a specialist who treats diseases of the brain and spinal cord, peripheral nerves, and muscles. Neurological conditions include epilepsy, stroke, and Parkinson's disease. Pediatrician, a medical practitioner specializing in children and their diseases. Pulmonologist, a medical specialty that deals with diseases involving the respiratory tract. It is also known as respirology, respiratory medicine in some countries and areas. Urologist, a physician who specializes in diseases of the urinary tract and the male reproductive system. Psychiatrist, a medical practitioner specializing in the diagnosis and treatment of mental illness. Obstetrician, an obstetrician is a doctor who specializes in pregnancy, childbirth, and a woman's reproductive system. Dentist, one who is skilled and licensed to practice the prevention, diagnosis, and treatment of diseases, injuries, and malformations of the teeth, jaws, and mouth. Selecting the correct health provider can give the health consumer the advantage of receiving accurate and appropriate medical treatment. It can also protect us from fraudulent health providers such as quacks. Quackery consists of three forms, and these are medical quackery, nutrition quackery, and device quackery. Medical quackery. Medical quackery approaches use fake, ineffective, and risky medical cure, treatments, and remedies of various health conditions, which includes drugless therapy or bloodless in nature. Nutrition quackery. Nutrition quackery involves promotion of food fads and other nutritional practices that claim to be all natural. Those are believed to have beneficial properties of multiple plants in one product. Device quackery. Make use of miraculous gadgets such as dials, gauges, electrodes, magnets, toning waters, and blinkers that are believed to cure certain health conditions. What would happen if we became victims of quackery? Let us go back to the story of Anna. Let's see what happened. Because of her experience, Anna was so disappointed and worried about the risk and reaction of the product that may cause to her. Due to the health problem brought to her, Anna wants to file a complaint to stop the selling and charge the business owner or the manufacturer. If you experience these fraudulent health services, you can report this to agencies protecting consumer welfare. There are government agencies and private organizations that help and protect healthcare consumers. Government agencies includes the Food and Drug Administration, Department of Health, and Department of Trade and Industry. The role of these government agencies are implement laws protecting consumers, make researches and test the quality of products, and give guidelines for the quality of products. Professionals and voluntary organizations help safeguard their members and all Filipinos by providing guidelines and information on different health products and services. Some of these organizations include Kilusang Mamimili ng Pilipinas, Philippine Medical Association, Philippine Dental Association, and Health Education Association of the Philippines. This time, for our assessment, get your paper and pen and answer the following questions. Read each statement carefully and choose the letter of the word that is being described. You have 5 seconds to answer each question after you hear the word go. Let's begin. Number 1. He specializes in the diagnosis and treatment of diseases of the heart and blood vessels. A. Cardiologist. B. Dermatologist. C. Pulmonologist. D. Neurologist. Go. Number 2. These include cures, treatments, and remedies of various health conditions that are drugless or bloodless in nature. A. Device quackery. B. Medical quackery. C. Nutrition quackery. D. Quackery. Go. Number 3. He specializes in diagnosis and treatment of eye diseases and disorders. A. Dermatologist. B. Gynecologist. C. Ophthalmologist. D. Radiologist. Go. Number 4. Who is the best to consult if you need maternal care services? A. Dentist. B. Obstetrician. C. Pediatrician. D. Urologist. Go. Number 5. The most reliable internet source where you can get updates about public health is A. Blog of a doctor. B. DOH website. C. Facebook. D. Google. Go. Now, let us find the answer. For number 1, letter A. Number 2, letter B. Number 3, letter C. Number 4, letter B. And number 5, letter B. Did you get all the answers correctly? Impressive! Here are the key points of what we have learned today. Selecting the correct health provider can give the health consumer the advantage of receiving the accurate and appropriate medical treatment. Having the knowledge of the different health providers can also protect the health consumer from fraudulent health providers such as quacks. Consumer health encompasses the health information, products and services being gathered, acquired, and availed by an individual. When availing of health products and services, it is important to evaluate the reliability of the sources and avoid fraudulent promotion or sales of products and quackery. To become a wise consumer and well-informed consumer, get to know the products and services, be meticulous with sales talks or marketing gimmicks, consult the authorities when in doubt, and never sacrifice quality from quantity. I do hope you have learned many things today. As for your assignments, you may answer activities from your printed module, and I'm sure your Mapeh teacher pretty much willing to assist you. Thank you very much for making yourself connected in our discussion for today. Once again, this is Sir Alfred Santos. Keep safe and be healthy every day. See you again in our next Valenzuela live streaming.